My name is Mike Krupa, and I will be your host for the series. A little bit about me personally. I actually started my career remodeling homes. I used to own my own business with my twin brother back in college, and ended up majoring in actuarial science, which is very different. But because of that, I fell into the insurance world, like most people fall into the insurance world. And I spent a lot of time helping employers manage their healthcare spend, underwrite their healthcare spend, and manage their healthcare spend. And I have been very frustrated over the last almost 20 years with that process because of the fictitious trend numbers that are out there and what insurance carriers have done with renewals. And so a few years ago, I got down a little bit different of a path. I found an organization called Health Rosetta, who is an organization really dedicated to transforming healthcare. It's a network of like-minded brokers across the country. And I started to understand why the healthcare system was broken. And once that clicked, it became pretty clear on what the fixes were. And then I started implementing those fixes with my clients. They started working. I realized I was remodeling health plans, and there it was. Remodel Health Plans was actually born. I'm a benefits advisor with Connor Gallagher OneSource, and Remodel Health Plans is kind of my baby, and it's how I help employers remodel their health plans overall. I do want to note here that we will be taking questions towards the end, and either enter those questions into the chat box or the questions. I'll be periodically looking over as well if something comes up, but I will be staying for an additional 15 minutes if necessary after the end of this webinar to answer any additional questions people may have. So just wanted to outline that. Okay, so talk a little bit about the purpose of this series and what we'll actually be covering. I want you to really think about this series like remodeling a room in your home. Today is an introduction to myself, or the general contractor, the broker advisor, and I'm going to outline the process that I use with employers to develop a strategy to do exactly what this webinar is supposed to do: build a sustainable health plan that your employees love. But then in episodes 2 through 5, think about that as like your subcontractors. We're going to interview various different partners within a remodeled health plan. Think about your electrician and your plumber when you're remodeling, a bathroom, for example. We're going to look at various different subcontractors within a health plan. And then finally, episode 6, or the final episode, I'm excited about that because we're going to actually show you the results, and very detailed results, of what a Chicago area employer did over the last few years to completely remodel their health plan. I'm going to highlight some of the results today, but then in the final episode, we're going to show you kind of exactly what they did and the results that they were able to achieve. So here's what this webinar is really targeted to teach you today and over the next 5 episodes is really 3 things. 1, how to avoid being surprised by your health insurance renewal. I see this time and time again from employers, the surprises. And we're gonna dig into that today on one of the easiest things that you can do to help avoid some of these surprises. And number 2 is I'm going to show you how self-funding will lower your costs if done the right way. And then 3, and very important to most employers today, is how do you actually make your health insurance benefits more competitive in the market? One message I want to stress is what I'm not going to talk about is how to just save you money, how to just slash your benefits. That all that does is really cause noise at the end of the day. There's an art to what we're going to talk about, which is improving the benefits and saving money at the same time. So let's dig in. When I talk to most employers, their health plan typically looks like the one on the left. They want it to look like the one on the right. This is my bathroom a couple of years ago on the left-hand side. And, things were falling apart within the bathroom. We had a leaky shower, just not a lot of functional space, did not like the looks of how things were, and we knew it could be better. And with the background that I have, decided to remodel it myself. Probably not the best idea with three little kids at home, but I kind of dug right in. And as I started doing the demolition, I started to understand why things weren't working the way that we wanted. I was looking at the products the previous builder had used, and pretty clear why things were leaking. But ultimately, at the end of the day, completed that project, and our bathroom is the one on the right. That's just the shower right there. And I got to say, we absolutely love it. My wife loves the bathroom. And that's what I want to stress, is that is the most important part when you are remodeling your health plan, is your members or your employees utilizing it. They have to love it. If not, none of this matters. You have to love it, or none of this matters at the end of the day. So, there's a few things that I want to stress really throughout this entire series. And first is just that. At the end of the day, you can do a ton of remodeling on your health plan, but at the end of the day, you and your employees have to love it, or it doesn't matter. Second is, and I'm going to be blunt, right? You have to stop making 1-year decisions on your health insurance renewals. And look, I'll say a lot of that is probably driven by your broker or the insurance carrier in terms of the timing that you get. But there are things that you can do today to stop making 1-year decisions, and that's going to be key going forward. And then finally is, you don't have to remodel your health plan all at once. By the end of this series, I'm going to show you what a beautiful health plan looks like. But just like homeowners, right? Every homeowner is different. Every employer is different in terms of the pace that you go, what exactly you want to remodel, and when you want to do it. So, just remember that is everybody's different. And so we're going to show you a lot of different things. This doesn't mean that you have to do this path right away. So, when I think about what has kind of held me back in remodeling my own home, and maybe what took me so long to actually do the bathroom, it's a handful of things. Of course, money can come down to it, but really at the end of the day, it's tough going through a big project like that, right? With kiddos at home, and picking things out can be overwhelming. Doing the work myself, it just gave me enough anxiety to basically stop me in my tracks. But ultimately, I decided I needed to do it. With your health plan, a lot of you might feel that anxiety today, right, in terms of doing something different. And I get that, that might be stopping you, but there's other things at play within the healthcare system as well that are holding most employers back. And it's important to first understand what these things are, because if you are going to remodel your health plan, you got to understand why things aren't working the way that you want. And so the first thing I'm going to do is talk about what is going on, what's holding us back. And the first thing is the insurance carrier. Back when Obamacare was passed, there was a provision baked into that law called the medical loss ratio, which essentially capped carrier profit margin at 15%. Felt like, fairly well intended, but had some really unintended consequences, because what the insurance carriers quickly realized is that if they were making $15 on every $100 procedure, the only way they were going to make 30 is that they charged $200 for that procedure, right? They had to increase costs. And that's what we've seen happen, over the past 13 years since it was passed. And, if you're looking at this slide and you're seeing these percentages here, you're thinking the same thing I am. We should have invested in carrier stocks back in 2010. We'd all be rich. They've outperformed the S&P significantly. United Healthcare, the biggest privately held insurer, almost a 1,400% increase over that time period. And the question I always ask employers, as an entity offering health insurance, but also as yourself who is utilizing healthcare, is, do you feel like you have had a 1,400% increase in the value of the benefits that you offer your employees or that you utilize yourself? Most of the time I get employers that laugh, right? Because the answer is absolutely no. Everybody says no to that. But the carriers are reaping big profits from these costs going up. So we got to think about that when we're remodeling a health plan. The next is this concept of the PPO network, which the fact that it's called PPO, Preferred Provider Organization, is almost laughable right there, because when you're Blue Cross or United or Aetna or Cigna and you have 95 or 99 out of every 100 providers within your network, like, how preferred can those providers feel? It's not that preferred, right? You wouldn't feel preferred if you were in a peer group of 99 out of every 100 of your peers. But members are comforted, right? Employees are comforted by that PPO network because it gives them unlimited choice. But here's what happens when you have unlimited choice and you don't really have great tools at your disposal as an employee or a member of healthcare, a patient, to determine cost and quality up front. You get this kind of price disparity. This is the exact same procedure for 10 different people. This is one of my clients that was considering remodeling a portion of their health plan. They had 10 different members go in to get a colonoscopy. Not exactly something that you walk into the ER needing, right? This is a pre-scheduled elective procedure. What we saw was on the left-hand side, you had about 5 people that were getting really good priced colonoscopies at about $1,000 a colonoscopy. And then over to the right, $2,000, all the way up to $6,000. And on other clients, I've seen colonoscopies, again, exact same procedure, as high as $10,000. This is the kind of price disparity you get within a PPO network. On the right-hand side, those are your hospitals. Those are places that are handling stitches, broken bones, COVID patients, and colonoscopies, right? They're not specializing in anything. They're the ones that are abusing prices. And then on the left-hand side, the interesting part about these providers, these are the ones that you want to go to. These are the highest quality providers. They do this all day long. They specialize in something, right? In this case, it's colonoscopies and probably a handful of other things. They're doing it every day, all day long, and because of that, they got really, really good at it. And they also figured out a way to keep their overhead low, right? These are the providers you want to be sending your employees to, but they can't get there in a PPO network structured the way it is today because they don't have the appropriate tools to get them there. So we got to think about this when we're remodeling a health plan. How do we fight that built-in incentive structure? And then the next is this medical ID card, right? You might be laughing at this, but it's true, right? You give your employees this medical ID card, but what they actually see and how they act is like it's an unlimited company credit card. And some of you on the phone, you may be fully insured, some of you may be self-funded today, but regardless, you have 20% of your population driving 80% of your costs. It's those large claims that are impacting what your fully insured renewal is going to be, or those large claims that are impacting what your cash flow, what you're spending your money on. You got to get control of that. Without any controls, people can go wherever they want, regardless of cost and quality, and there's no controls in place, right? You're paying for it at the end of the day as an employer. And here's the result that most employers are seeing, right? When I talk to clients or prospects about what they're feeling this, right? Every single year, they're shopping carriers, right? They're going to the market to Blue Cross, United, Cigna, and Aetna, and they're hoping that one of those carriers comes in competitive so they can use that as negotiating leverage to stay with their existing carrier or move if they need to, right? I get it, but that's all you feel like you're left with, or increasing deductibles and out-of-pocket maximums. Maybe it's adding a network that includes less providers, right? Adding an HSA plan to continue to shift cost to your employees, and if all else fails, right, there's employee contributions, the payroll deductions. We increase those, and I get it. When you're getting your renewal 30, 60, 90 days in advance of your actual renewal date, kind of feels like that's the only choices that you have. And so this is why I created this process, Remodel Health Plans. Look, my goal is to give you the confidence that you can build a plan like this that your employees love. I have 3 little boys that are going to be entering the healthcare system. This is insurance. This is not the most exciting thing, but if we can leave it in a little bit better of a place, if I can, I feel like I've done my job. So I want to help employers do this. But the first thing you need to do as an employer is you need to establish some level of control. If you're fully insured today, that control means getting access to your data. Simple. I've seen time and time again when I'm talking to prospects, they don't even know that there's a lot of data available on their plan because their broker's not providing it to them. So you got to start asking for that data. Once you start understanding what's going on in your health plan, it will make it easier to take additional steps down the road. And if you're a self-funded employer, control, yes, also means your data, right? You got to understand exactly what's going on in your plan. And when you're self-funded, you have a lot more access to data. But the control that you have, or the ability of the control you have as a self-funded employer, allows you to do step number 2 in this process, which is align your health plan with partners that have your best interests in mind. And so I want to come back to, remodeling a home here, right? And using that analogy, right? So think about your broker as your general contractor, right? When you're remodeling a bathroom, you hire a general contractor. Well, how that general contractor makes money very much depends on what the final price you're going to pay is, right? You got to understand that. Are they going to charge you a flat fee to do the whole project, right? That's ideal, so you understand exactly what they're making. But here's what's more likely to happen, right? You're going to hire somebody who's going to lead that project for you. They're going to make money. They're going to charge a fee for that. They're going to hire a bunch of subcontractors, an electrician, a plumber, a drywaller, you name it. They're going to mark up their fee, right, by a certain amount, say 10%, to coordinate all that together. They might be charging that on top of their fee, right? And then you got the materials. That's a whole other thing, right? If they're providing you all the materials, they're marking up the price of those materials, right? If they want you or are forcing you to use their materials, they are marking up the price and they're making money there too. So there's all these hidden costs potentially if you don't have the right general contractor. So you got to start there. You got to start with hiring the right broker, and you may have that right broker today, but then it goes a step further, and you got to understand the different subcontractors, the different solutions, right, that you're hiring within your health plan. The single biggest thing you can do and your broker can help you with is understanding how those subcontractors are paid. You got to understand what they're incented to do. Here's what I mean. So take the general contractor, right? You have to use our materials. They're incented to use the materials that they're providing because they're going to make money, right? Now think about prescriptions, right? If you have a prescription drug manager that is being paid a percentage of the cost of the drug, guess what? They're incented to do 2 things. 1, fill more drugs, and 2, fill higher cost drugs. So understanding that is huge, because now you might be able to do something different with it. Understand how those partners are paid within your health plan. And that's what we're going to talk about in the future episodes, right? Is these different subcontractors and exactly how they get paid. Starts with your medical, your prescription drug, and there's a lot of other partners within there. But when you got Blue Cross owning their own pharmacy benefit manager, and you got United Healthcare owning their own pharmacy benefit manager, then you have Cigna owning their own pharmacy benefit manager, and then CVS Health, which actually owns Aetna, a medical company. There's a lot of conflicts of interest within there. And when they don't disclose how they get paid, there's even more conflicts of interest. So you got to understand that. And then the final thing is right, the first thing I told you about remodeling a home, a health plan, you got to love it at the end of the day. Your employees have to love it. So you have to figure out ways to reward them for making good healthcare decisions. I'm going to go back a few pages here to this example. $6,000 colonoscopy down to $1,000, right? Imagine this is a knee replacement, and imagine that employee has a $200 copay to go to do that. Wouldn't you save the difference of $6,000 and $1,000? Wouldn't you save that all day long as an employer? Make it free for the employee, pay their $200 copay to save $6,000. Everybody would, right? And it's a higher quality. They're getting better results at the end of the day. And so that's what has to happen in a remodeled health plan like this. There's so much waste within the healthcare system that you can offer things for free, reward people for making good healthcare decisions. That's how you get them to change their behavior. And at the end of the day, when you're getting people quality care, you're going to have more productive employees. They're going to be present in the office. You're going to offer them things for free. It's going to lower their costs. It will lower your costs over time. But most importantly is you just get out of this cyclical hamster wheel of shopping carriers every year. You get the confidence that you're on the right path, that you can get control of this. And that is super important. Real quick, I'm going to check if there's any questions. Anything in the chat here? All right, not yet. So I'm going to keep going here. All right. So I told you we'd talk about how to avoid a surprise health insurance renewal and what you can do. And if there's one thing you should walk away from today's webinar, is you got to stop making one-year decisions. And what does that mean? That means you need to start planning, right? A successful remodel requires planning. You don't just hire a general contractor and say go at it. Guess what? You're going to be stuck with surprises. You're going to be stuck with upgrades you didn't want, and at the end of the day, you're probably going to have a little bit of buyer's remorse. So what you have to do with your health plan is the same thing. It's what you probably do in any other aspect of your business is you set up a long-term plan. When you set up a long-term plan, you can execute on that plan, and you will start to change the trajectory of your costs and the quality of healthcare that employees are getting. This is just a very, very high-level sample. I go into much more detail with clients on this, but just to give you a little bit of framework, right? The first thing you got to do, I said it already, but I'm going to stress it again, is you got to hire the right broker, the right general contractor. You are trusting them to make decisions for you, to give you advice so you can make decisions. And so if you don't have the right partner to start with, you're not getting the right advice. You may not even have a long-term plan in place. So that's the first thing. The most important thing is make sure you got the right broker. The second thing is you got to make a plan, right? You got to start setting up some sort of plan. And then the third is start educating the stakeholders within the plan. Your CFO, your CEO, your HR, you got to get everybody on board, speaking the same language. And what this means to me is it means education, educating you on all the different solutions that are out there, whether you'll ever implement them or not, right? Some of the subcontractors that we're going to review throughout this series, you got to understand what's out there to figure out what is right for you. This education phase can take a lot of time. I'm not saying that this has to happen all in year one. It could take some time to do this. So year two, which could be year 3, for the record, is solidifying the control by actually self-funding your health plan. And I want to stress this one more time, is that you might be fully insured thinking like, there's no way I'm going self-funded next year. That's okay. You got to hire the right broker first, right? You got to establish some sort of plan. It might take you 3 years just to get to this point. But you solidify your control by self-funding, and then you align with the right subcontractors. Start with medical and start with prescription drugs and start rewarding employees right away. And then by year 3, year 4, year 5, you're exploring additional subcontractors within the health plan. You continue to reward employees. You got to measure your success, and then you tweak, right? This isn't set in stone, but you got to have some sort of plan as a baseline. And this is what one employer in Chicago actually saw, right? These are the results. This is what you can expect to happen. This is an employer that was in that year 1 for 3 years, right? They didn't end up doing anything until 3 years down the line, but they were faced with a 35% renewal from United Healthcare in 2022. And United Healthcare was not negotiating at all. And Blue Cross was not competitive. Aetna declined to quote. Cigna declined to quote. So ultimately, we've been talking to this employer for a few years about what they could do. Well, they ultimately decided to go self-funded, and they made some major changes to their health plan. They saved $300,000 within the first year by moving to a self-funded health plan. And here's the best part. They reduced their deductibles by $3,000. They eliminated their HSA plans, which what that really means is now employees had copays for their prescriptions, no barriers to care to getting the prescriptions they needed. And then one of the best parts is they had almost 2/3 of their population in a plan that had free, unlimited primary care and saw a 60 to 70% reduction in their contributions. Incredible results. We're going to talk about that more in the final episode. Next episode, we're going to dig into a solution that is significantly changing the healthcare landscape called direct primary care. Purchasing primary care, just like a gym membership. So I'm excited to talk about that in the next episode. It's just a follow-up here. I post a ton of content on LinkedIn. I create a ton of videos. I'm trying to educate employers. Connect with me on LinkedIn. Subscribe on YouTube. If you want to talk separately, schedule a meeting with me. Here's all the QR codes to do all those things. Now I'm going to start with some questions here, and let's see. I do have a question coming up, and I will stick around as long as everybody wants. How does an employer assess who is the right broker for them? And how do you know if they are blowing smoke or know their stuff? That is a fantastic question. So let me maybe start with the latter one. How do you know if a broker is blowing smoke or they actually know their stuff? Well, I think it comes down to experience, right? There's a lot of employers that talk about, or there's a lot of brokers that talk about self-funding and different solutions in the marketplace and different things that you can do. There's a lot of them that just talk about it and they don't actually do any of these things. You want to find a partner who has experience doing all these things and who has results. References are great, right? You want to talk to their clients about the different things that they can do. But there's a lot of brokers out there that'll just do what I call spray and pray. They'll just spray all these solutions on there, talk about them, right? And they're not actually implementing any of them. You want someone who's got experience doing these types of things. So that's the first thing that I would talk about or that I would explore. You got to interview, right? Like, think about a handful of brokers that are out there. You got the big houses, you got smaller boutique firms. We're a smaller boutique firm compared to like a Mercer or an Aon. So get a good mix and interview them and see what kind of things that they offer. What do they do to help you avoid surprise health insurance renewals? But start to evaluate it that way. Great question. All right, I got a couple more coming in. And happy to talk about that in a little bit more detail. If you have follow-up questions on whoever asked that, please ask them. All right, here's another one. This is a good one. How big do you have to be to do something like this, to actually remodel your health plan? Great question. So I'll tell you, size does matter a little bit here. I generally tell employers, if you have 50 or more employees, not necessarily enrolled on the health plan, but if you have 50 or more employees, that's kind of the target minimum here. I've personally done these types of things with employers that have 30 employees on the health plan, up to 40,000 employees on the health plan. But having some size does matter here, because the fact is it's harder to get data the smaller employer you are. Harder to get a self-funded stop-loss quote, which is really what pulls this all together. So having at least 50 employees is a good starting point. If you don't have that many, that's okay. I'll tell you, there's still some pretty creative things that you can do. Maybe it's not going fully self-funded, but there's still some creative things that you can do. And happy to talk about that offline a little bit more if you'd like. Let's see here. Okay, sorry, just looking over at the questions. All right, got another one here. Oh, this is a good one. Can you remodel a health plan with Blue Cross Blue Shield of Illinois? Well, I guess the answer to that is maybe. What's interesting about Blue Cross, or really any of the other major insurance carriers, is sometimes they set their own restrictions. So take Blue Cross, for example. You know, one thing that we're going to talk about in a later episode is pharmacy and doing something different with your prescription drugs. One of the lowest hanging fruit on your health plan, frankly. Well, Blue Cross Blue Shield, if you're with them and you're self-funded, they're only going to let you do something if you have at least 500 employees on the health plan, which is a lot. That's when you can start, actually making an impact. What's the reason there? Well, they own their own pharmacy benefit manager, Prime Therapeutics. They're making a ton of money on the prescription drugs, so they're incented for that to stay with them, and so they require it. So you can do certain things with them. You do have to be a certain size. I will say they provide a good amount of data, though. So whether you're fully insured or self-funded, if you're with Blue Cross, you can start to get a really good idea of what's going on with your health plan. And that's where I'd start there, is understand the data. Make sure your broker is getting you that data. For the person that asks, how do you assess who is the right broker? It's another thing to ask yourself, like, are they giving you data? There's data available, likely, right? If you're with Blue Cross and you have 50 employees on the health plan, you got a lot of data available. You may not even know that that's there. So start challenging your broker a little bit there. Okay, next question here. Okay, when should I start this process if I'm a 1/1 renewal? There's a lot of 1/1 renewals out there, right? A lot of people that renew on January 1st. My answer to that question is you start yesterday, you start now. You start. That's the most important part. I recognize that you may be getting your renewal 30, 60, 90 days in advance, right? Most employers, if you're fully insured, aren't getting it, past 90 days in advance. And so you feel like you don't have a lot of time to do anything when it gets to that point. But that's why you got to start creating a long-term plan. You got to start planning now. You got to start educating yourself. Like, the first thing you do is you switch your broker if you need to, right? You may not need to switch your broker, but you got to get with the right partner that's going to help you build a long-term strategic plan. If you start planning today, you will start to change the trajectory of your renewals down the road. But if you wait until you get your renewal, you're likely going to end up doing the same thing that you've done every other year, right? And I get it. You don't feel like you have enough time. And at the end of the day, you end up just staying. So, so many times when I talk to prospects about these types of things, I tell you it's interesting to them. They like it. They like what I'm talking about. But sometimes they'll get we're not ready to make those types of changes yet. So we're just we're gonna stick with our current broker, right? We'll think about moving over when we're ready to make those changes. Well, unfortunately, what I see in those scenarios is that no change ends up happening because it takes time to educate on the different things that are out there and what's right for your employees and you as an organization. And you need the right partner to do that. That's the first place to start, is hiring the right partner that's gonna teach you these different types of things. So highly stress that. Let me see if we got any other questions or anything in the chat here. Okay. Nothing else, but let me go back to that one other question as things are popping in my head about, do you have the right broker? Let me give you a couple of other things that you can think about. Let's talk about how the broker is paid. Now, I'll first say that, if you're fully insured, sometimes you can't control how a broker is paid on the medical side. They're just built into, like, commissions are just built into the rates and they're filed with the state. It's not anything you can control. So just kind of keep that in mind. But think about like your other lines of coverage, your dental, your vision, your life, your disability. Understand how much money they're getting paid on that. So when you're interviewing brokers or you're kind of evaluating your existing broker, first thing you should do is understand how they're getting paid and how much they're getting paid. It's actually your responsibility now as an employer. With the Consolidated Appropriations Act that was passed a few years ago, it is your fiduciary duty to understand how your broker gets paid. They should be providing you some compensation disclosure, but if not, you should be demanding it, because if you ever got audited and the DOL started asking for those types of things, you better have it on file. So understand exactly how your broker is paid. And if you're in the event, like you're in the situation where you're fully insured, but you're big enough where the broker can actually control the commissions or self-funded, and the broker can, there's really ultimate control, I should say, for the employer to control the commission structure. Start understanding how they get paid there. They're getting paid a percentage of premium. I'm not going to say that they're a bad broker, but just, start to challenge them on maybe charging you a flat fee instead and see if they're willing to do that, because there's no reason your broker should be getting a 20% increase in how much they're getting paid when you get a 20% increase in your health insurance costs. If your broker's getting paid a percentage of the stop loss premium, if you're self-funded, it's the same thing, right? Like, why should they get rewarded more when your plan, right, is getting worse, when your costs are going up? So understand, how they get paid. That's a really good starting point when you're evaluating your broker. All right. Final questions here. Okay, no other questions. So I'll just kind of close things out here. Obviously, our next episode is in 3 weeks. Every 3 weeks, we'll be doing this for the next 3 months. Same time, 11 o'clock Central. My goal is to help do some of that education for you up front right now, right? Think about how to establish your long-term strategic plan in time for January 1st, if that's your renewal. And if your renewal is a different date than that, just, continue to think about the different things that we're going to talk about in the future episodes and if it could be right for you. I'm looking forward to the next few episodes and ultimately showing you what a really good health plan looks like. I appreciate everybody joining today. Here's my info. You know how to connect with me. Would love to connect with you, or just check out some of the other things that I'm posting on LinkedIn or YouTube. So thanks so much for everybody for joining today, and looking forward to seeing you next time.